Welcome to Big Sky Care Connect user training. This video is intended as a quick but thorough demonstration of the BSCC Clinical Viewer. Starting on the BSCC login page, the blue box under the logo displays important system alerts. You can see there are none currently shown. Less urgent announcements are displayed under Big Sky updates. For example, the latest post announces that Granite County Medical is now sending demographic and lab results. Below the login area is the forgot password link, how to contact the help desk, and a notice outlining your responsibility as a BSCC user. I am logging in as a clinician with full access to patient data, including sensitive data. We also have user roles for clinicians with limited access, support staff, and payers. The login lands on patient search. The basic search allows users to search by name, gender, date of birth, and phone number. The advanced search, accessed by clicking here, allows search by address and medical record number. I am going to search by medical record number. I put in the number and the facility and hit search, and the results display to the right. Click this arrow to see a list of all the medical record numbers associated with this patient. The icons indicate what data is available from each facility. Hover over any icon to get its description. David's record contains most of the data elements found in a BSCC patient record. Let's go ahead and open his record by clicking on the top name. You might see a green line advancing along the top and a message awaiting patient data from somewhere. Click refresh to update once click refresh to update the screen once retrieval is complete. Along the top, we see basic demographics. The icons to the far right link to additional patient information. Click any icon to view the lists and click again as a quick link to that section of the chart. Here I've clicked on patient has allergies, and now I get a list of the patient's allergies. I click on back to chart book to go back to the main screen. The ellipses in the top right corner display patient demographics. Notice the message in the upper right corner, this patient has restricted data that is not shown. I see this message because I am assigned the role of clinician with sensitive data access. Sensitive data is defined by BSCC as coded data falling into one of 6 categories: behavioral health, substance abuse disorders, reproductive health, HIV, STD, or genetics. To display this data, click on the Override Data Restrictions button, then click Acknowledge and Override. And the message is updated now to say override apply. And now any sensitive data this patient has is displayed. The blue check up here indicates the patient is active with Medicaid. Click on the check mark, then view eligibility to see the information. Do not use this information to verify Medicaid eligibility. Contact Medicaid directly for payment authorization. Along the left side is the chart book navigation tool. A blue bar next to any section indicates that data is available in that section. The record opens up to the demographics section. Demographics contain patient address, phone, primary care contact if available, patient contacts, and death information if applicable. Each window has a similar layout. Let's look at medications, which has 2 subsections, current and historic. A medication is current if it's been prescribed or refilled within the last 90 days. Within each section, there is a free text search and sort options. A useful sort within historic meds is to do a primary sort on medication and a secondary sort on date. That way, if you look at a particular medication, you can see the refill history for that medication. Anytime you see the ellipses, you can click for additional information. For meds, I find details such as ordering provider, the pharmacy, and patient instructions. Use the back to breadcrumb to navigate back. MD MPDR accesses the Montana Prescription Drug Registry. Click Get NARCS scores to generate a report on the patient's controlled substance usage. BSCC receives medical and pharmacy claims from Medicaid. Medications, diagnoses, and procedures are pulled from claims files and displayed in the BSCC patient record. Let's look at diagnoses. The options along the top are used to filter data by clinical claims or from both sources. The same filters are displayed for procedures and services. BSCC receives a variety of clinical documents, including discharge summaries, ED visit notes, and continuity of care documents. These documents are found under Documents, listed in reverse chronologic order. Open the document by clicking the link. This is an example of a continuity of care document sent by the VA through eHealth Exchange. Click the back button to navigate back. Now let's look at labs. Lab results are presented in two views. I find the view by date, this top view, the easiest to navigate. There is a list of the lab tests with the dates and times of available results. Click on the date to get full details for that test. When there is more than one result, a cumulative view is available, and you get that by clicking this table icon. You can also graph by clicking this graph link here to graph results to get a visual representation. To get back to the main menu, I click here and select Chartbook from the breadcrumb drop-down menu. Vital signs are presented in standard table format. Immunizations are organized by type. Each type can be expanded by clicking the arrow, or I can expand everything by clicking this Expand All button up here in the upper right corner. Patient history information is extracted from incoming continuity of care documents. Here you'll find data such as tobacco history, alcohol use, and assessment scores. Encounters include inpatient admissions, ED visits, and outpatient appointments. BSCC receives imaging reports and studies from several partners. The information is found under Diagnostic Studies. Click the report link to view the results, the report of findings. If the study is available, the actual study, you will see this view image link. You click the link and you check the box. It takes a little bit of time to come up. These are big studies. And then you click next, it'll download and you'll get the image display. And there's a set of tools up here along the top that can be used to annotate the image. A description of these tools can be found on the BSCC website under training. Let's move to the patient summary report. Click on the Patient Summary Reports icon located in the left-hand menu bar. From here, I can generate a summary that includes most of the data contained in the record. Clinical documents are not included. The summary can be viewed in several formats, and I can generate the basic summary or an expanded version that includes a list of documents. You can download the summary by clicking the Download Summary link. The report can be filtered by clicking Filtered. I can limit the data by time, so if I just put in 30 days, or by data type. For example, I can go in here, clear all the encounters, and just pick a few. Once I've done that, I click Apply Filters, and then Preview to see my final report. You log off of the system by going to the drop-down menu, clicking on your username in the upper right corner, and select Logout. Additional training materials are found on the BSCC website at mtbscc.org. There is also an interactive map that provides up-to-date information on partner locations and data feeds. A final note about your responsibility as a BSCC user. Like your facility policies, users are expected to only access BSCC data in a manner compliant with HIPAA and BSCC policy. All user activity is logged and reported to your facility. Users are not allowed to access their own or family members' record if not for legitimate treatment purposes or otherwise allowed by HIPAA. Any suspicious activity is subject to further investigation. Unauthorized access may jeopardize the user and their organization's participation in the network and may result in fines or penalties imposed by law. Thanks again for taking the time to learn about BSCC. We look forward to working with you and providing the best care possible for all Montanans.